Welcome to the first episode of Aesthetic Talks. I'm Ivan, the co-founder of Aesthetic Links, the first platform which helps you find the best clinics based on word of mouth and true ratings. Today, we have the honor to be with Dr. Madi, straight from Geneva. Enjoy. Dr. Madi, we're today in Dubai. How are you doing?
I'm very good. Thank you for having me, Ivan. I'm very excited to be here for your first talk.
Thank you. Thank you so much. So, could you please introduce yourself? Tell us about you.
So, I studied medicine in Geneva in Switzerland and became an internist and practiced for 15, 20 years as an internal doctor. And then I decided to switch to aesthetic medicine because I was very attracted by the fact of being able to help people in a different way. It is a very interesting field, very fastly growing, both scientifically and the demand also is growing. And so I was very interested in that. And around 15 years ago, I started in that field. And now here I am. I have a clinic in Geneva, and I come to Dubai every month to treat clients in Dubai. It's a very exciting field and a very promising future.
Where have you started? So in Geneva or before that as a doctor?
So in Geneva, yes, I had my clinic in Geneva as a family doctor for many years. And then progressively, I switched from internal medicine to aesthetic medicine by doing a lot of trainings, going to the best doctors, conferences, workshops. In Switzerland, there's no university degree for aesthetic medicine. It's the non-surgical treatment of aesthetics. And so you have to basically train with different doctors in different clinics all over the world to gain experience and become a renowned doctor.
Amazing. So now we'll deep dive a bit more now in your clinic. Can you tell us a little bit more about your clinic, how you started it and so on?
Yes, so my clinic in Geneva is close to the university hospital in an area called Champel, where many doctors are based. And I have a team of 5 beauticians who are either laser technicians or beauty therapists. So they all are in charge of the different treatments that we provide. They also help me prepare the consultation. So the pre-consultation is done with these therapists while they greet the patient, remove the makeup, prepare them for the injection treatment. And they can also counsel them and explain to them about the treatment before they actually see me. I also have Dr. Diana Cerruti, who's a young, very skilled doctor who started with me more than 2 years ago and who has also her consultation. She's specialized in skin quality treatments, which is a very demanded thing. Maybe we'll talk about it later, as well as laser treatments. So we're a team of 7 in a very nice building that's basically Art Deco, one of the rare Art Deco buildings, renovated in a very nice area of Geneva.
Amazing. So after that, we'll jump into treatments specifically. But just before that, what are your clinics, let's say, top 3 specialties?
So my main specialty is what I call full facial rejuvenation. Basically, the approach today for aesthetic medicine is to evaluation of the face as we age in different layers, the bone, the fat, the collagen loss in the skin, the muscles. So we have a multi-layer aging and also a multi-layer treatment. And treating the face in a comprehensive, what I call full face approach, is not something that is easy. It requires a lot of expertise in the assessment and the choice of the treatments to combine. And this is what's going to deliver a natural result, which is what our patients and clients request. And the most difficult part in medicine in aesthetic medicine is to provide a result that is natural, yet having combined different treatments. We also are specialized in skin quality treatments, things that are very demanded like acne scars, hyperpigmentation, and we use very up-to-date treatments that we will talk about maybe later, such as polynucleotides, exosomes, and things like that. And obviously, Botox, hyaluronic acid, and collagen biostimulators. I would say these will complete the platform, the 3 main treatments that we provide.
All right. All right, then that's perfect. And now we'll deep dive onto the most exciting part of this podcast, I think, which are treatments. It's also quite funny and interesting, as I was telling you at the beginning of the podcast off camera. I'm not the expert in the treatments from our app. I'm specialized into everything that's tech and marketing. But I love it because I see treatments as the newbie angle. And as I was saying, and you were telling me, a lot of people don't know what they need when they go to a clinic, or think they know what they need and come for the wrong treatment. So what's your opinion about that, first of all?
It is true that in aesthetics, what we observe in our everyday practice is that people either come because a friend told them that they had such a treatment, let's say Exosomes or Botox, and they like the results, so people come to get the same treatment. But also something that's very common is because there's a lot of marketing in aesthetics. Clients and patients come to see us because they have heard about the treatment, and they will come and say, well, I heard this treatment, do you think it's good for me? The whole thing is trying to explain to the patients, assess them, and choose the appropriate treatment. Sometimes it could fit what they were looking for, but sometimes not, and you have to guide them towards the best treatment for what they need to have. And very often, I would say, we don't have one treatment that fits all. We have the best treatment for every indication. So, for example, if you're looking to reduce wrinkles in your upper face, obviously it's Botox. If you're looking to treat a volume loss or structural loss, such as a retruded chin or a loss of jawline definition, you're going to use hyaluronic acid. And if you want to improve the firmness of your skin and improve your collagen content, then you're going to use a collagen biostimulator, just to give 3, let's say, common examples. So I would say the most important thing is guiding the clients and the patients towards the best treatment that's suited for their concern.
Amazing. That makes me jump to another question, which is, now that we're treatment focused, what treatment is the best, in your view, for anti-aging? I know it's not an easy question, I imagine, and it's also case by case, as you were saying, but if you had to give it a take.
So let me maybe start by an introduction. What's very interesting is, although medicine is a very old discipline, but aesthetic medicine is quite a young discipline. People, specialty, let's say. What people often forget is that aesthetic medicine has basically started, let's say, around 30 years ago. Botox has been FDA approved in the early 2000s, although it's been used for 30 or 40 years. The hyaluronic acids that we use today have been known for like 25 years, 30 years, and they have evolved a lot. So the quality of the products that we have changed a lot. We used to have one hyaluronic acid. Now every brand will propose 6 or 7 different types, different thicknesses, which are adapted for different areas for the face. You're not going to put the same hyaluronic acid in the cheekbone compared to the lips, which is an area that moves a lot, that requires a less thick product. That's one example. Another thing that's very important is that we understand much better now the aging. So since your question is about anti-aging, we know how to reverse certain problems. So for example, we know that not directly treat the nasolabial fold because the nasolabial fold becomes deeper with time because we get sagging. And so you need to improve first the sagging, you need to improve the volume loss, and probably indirectly you will be improving the nasolabial fold. One example. So the whole idea is to treat the cause of the aging process and not the consequence. For example, when people have wrinkles and lines in their face and they have sagging, another way of treating it is to treat with collagen biostimulators. These products have been known for like 20 years, but only in the last 10 years have they been used in a way that actually promotes collagen production. So I would say the combined effect of better understanding of the aging process, better understanding of an injection anatomy, and a better choice of products and devices allows us to treat today. Now, your question is also broader because anti-aging, there's the part related to the face, but also there's the part related to the body. meaning, for example, nutrition, supplements, antioxidants, etc. There's also the whole part related to the skin, all the products that we may use for the skin to improve the skin quality and slow the aging process. It's a very vast subject, and it's also a subject that we deal mainly with body and facial treatments. For the moment, we are not providing treatments of general anti-aging, such as nutrition supplements and things like that.
Right. What you were saying at the beginning is I heard a lot of 10 years, 20 years of testing. So a lot of products which have been used for a while. In your sense, what's the required amount of time a product has to be tested? Is it fine to go with newly released products? What's your benchmark here? What do you think?
So I think most of the products before any drug or product is put in the market, there's on average between 7 and 15 years of research that's been going on. So very often when we hear about a product that's new, we think it just came out of the box, but actually the research has been going on for years. And actually the products that we use, if you look at hyaluronic acids, most of them, especially the big brands, they have been studied in many clinical settings, and also they have FDA approval for the indications. Also, for example, Botox has been used for 40 years, but the approval takes time because the authorities, such as the FDA, require a lot of studies. It's very costly for pharmaceutical companies and time-consuming, and that's why it takes time. And in medicine, in many situations, we use what we call off-label treatments, which means even if the product is not yet approved by the FDA for the indication, doesn't mean not approved as a medicine, but not approved for the indication, we may still use it safely. Now, what's very important is to use products that have been studied. What I would not recommend is for patients to use products that have been bought on the internet, that have been maybe developed in some countries where no studies have been provided to be FDA approved or approved by any medical authority in a Western country. There are some products that are dangerous. There have been cases described of major side effects with Botox that is not the regular Botox that we use. And also there have been complications with hyaluronic acids that are sold at a very cheap price and that are not good quality. So I think one advice I can give my clients is that for the face and the body in general in medicine, although I understand that in some cases the budget is an important parameter, but when it's very cheap, one should be very suspicious about either the quality of the product or the qualifications of the provider.
It's funny. Everything you're saying makes me have questions that pop in my head,
Yes.
especially so we're in conversation with some clinics every day, some that try to apply to the platform and so on. And a big red flag for us is we know that injectable prices can be so much lower. It cannot go lower than a certain price. And for us, it's a huge red flag when some prices are so low. We know that there are a huge amount of knockoffs, especially in Dubai. Many clinics, but I think not only in Dubai, but many clinics just buy knockoffs or too old injectables, which shouldn't be used. So yeah, that's why it's really important to have a trustable clinic. And then another question, not just myself, which I have this question that popped. Botox. You were talking about Botox. I've seen through the app that Botox can be used as much as for the face, but also the body and the underarms. So can you tell us a bit more about the use cases of Botox?
Yes. So actually, Botox initially was developed to treat, eye-related issues like strabismus, And so the doctors who were using this at the time noticed that there was improvement in the wrinkles. And so then came the development into aesthetics. Now, what's interesting to know is that Botox in most countries is registered as a medicine, as a drug, and then also registered as an aesthetic treatment. And actually, the medical indications are very, very numerous. So to give you a few examples, other than the aesthetic uses that we know, which is treating upper face wrinkles, Botox can be used, for example, in the masseter muscle, which is the mastication muscle, for people who have bruxismus, which is grinding of the teeth, bruxism. It can be used for underarms to treat people who have hyperhidrosis, which is excessive sweating. It can also be used extensively in urology. It can be used to treat migraines. It can be used to treat what we call neuralgias, which are very sharp pains that occur in the nerves in the face and are difficult to treat with other means such as medicines. It can also be used to treat people who have muscle contractions that are very important, like in the neck or the shoulder area, and that can be responsible for very severe pain. And also patients who have been afflicted with a stroke, for example. Usually the side that's been paralyzed can become very, very rigid, and sometimes the limbs are very difficult to move for everyday care. And so these muscles can be targeted selectively by a neurologist in order to treat them. And also another example that crosses my mind is a bladder. Sometimes people have spastic bladder after following a car accident where you have paralysis, you have injury of the spinal cord, and it can be used to release the muscle tension. So there are really many, many indications, and people don't know, but it's the most studied medicine in the world. Look, it's the most studied medicine. So really, it's very safe. People are always worried that we use minute amounts of a poison, but in medicine, there are many, many examples of medicines, antibiotics, that could also be toxic if used at high dose. And what I always also tell my patients to reassure them is that even some plants are toxic. So things being natural does not exclude them from being toxic. And there are many plants that if you consume them accidentally because you don't know what they are, you will get very severe toxicity, if not worse.
Yeah, we have the example with dafalgan, for example, which you can't overtake.
Exactly.
Super.
Paracetamol, the most used medication in the world for pain. If you use beyond a certain number of grams, you can get severe toxicity and even death.
Yeah.
Yes.
No, super, super interesting, especially Botox. I didn't know it has so many use cases. That's great. Now I'm going to jump to another product, which are exosomes.
Yes.
We made a video that we'll soon release together with Stephanie. So can you tell us more about what are exosomes versus PRP also, for example? What do you think?
So maybe a little background about these products. So we've always been interested in medicine in regeneration. And so the pathways of aging and the way cells function, the ways they give orders, we know that a very important cell in the body is called the stem cell, which gives orders to other cells to produce proteins, collagen, elastic fibers. So the question is, how do we get stem cells? So obviously you can get stem cells from your own body, but you can also get them from other sources, animal sources or other humans. But one of the problems there when it's animals or humans is the ethical issue. There's a safety issue. There's also a tolerance issue, which means we know, as you know, we react to anything that's foreign to our body. So severe allergic reactions are possible. And in the case of human stem cells from other humans, we have the risk, of course, of transmission of either infectious or cancerous diseases. So for the moment, although these products do exist, human stem cells do exist, they are marketed in many countries. They are marketed in the US. They're present in Asia and some countries, but not in Western Europe officially.
Sorry, just I stop you for one question. What's the process? There are some donors of...
Yes, exactly. Okay. So, for example, in Korea, you have a few donors, and it's always the same donors that are giving the cells. So you were talking about PRP. I would say PRP is the most simple way of obtaining some stem cells and growth factors, because you draw blood. It's your own blood. Yeah. You put it in a device that spins for 5 minutes, and by spinning, it will separate red blood cells, white blood cells, then platelets, and then you have the plasma. Plasma is the liquid in which all these cells are bathing. And so what you're going to do is resuspend the platelets in the plasma, and that's why it's called platelet-rich plasma. You don't use the red blood cells and the white blood cells. Now, that was in technique, the PRP was invented in the 50s by a French doctor And it was used initially for rheumatological diseases, meaning diseases of muscles and joints and things like that. And actually, even today, some football players and other athletes, when they're injured, it's used sometimes to accelerate the healing process in their muscle. And then there was the use in aesthetics, such as improving skin quality or treating like some scars or things like that, and also for hair restoration. Now that's PRP. As you said, we're talking a lot these days about exosomes. So what's interesting is that we're talking about them today, right? But they were discovered in the 80s. So you see, we think like when someone tells you exosomes and they never heard about it, they will think maybe it was discovered a year or two ago and it's experimental. So no, exosomes were discovered in the 80s. And initially it was thought that they were mainly used to eliminate like garbage trucks, like to eliminate garbage from the cells. And then in the 90s, researchers from Stanford discovered that actually these exosomes are actually like a signaling tool. Basically, stem cells release them, and they are used to give orders to other cells to produce collagen, elastic fibers, etc. And so in the last few years, a plant-derived exosome has been developed. Now, although not as sophisticated as the human exosome, it carries the main functions that we need until further research is done to use other sources maybe. And so for the moment, what we use in our clinic is plant exosome. So there are two ways to use it, for the skin or the hair. Now for the skin, we use it either to improve certain problems like pigmentation, redness, some scarring. It can be used for things like that. It can be used also in the skin following an invasive procedure that causes downtime. So, for example, if you take a treatment like Morpheus 8, which is radiofrequency with needles, or if you take a laser peel, CO2 laser peel, or erbium YAG laser peel, these cause redness, a bit of swelling for a few days, depending on the intensity of the treatment and your body reaction. Using exosomes following these treatments will reduce significantly the downtime. And this is something very important. I would like to talk about it for a couple of minutes because today, even though aesthetic medicine has developed tremendously, one of the main drawbacks for the moment for certain procedures is downtime. People are very active, they travel, they do not always want to say what they've been doing as treatment. So redness, swelling, bruises are no-nos. So having exosomes helps some of our patients to have the shortest possible downtime. And also these exosomes can be used in a cream that clients will use at home for a week or 10 days to accelerate the healing process. Finally, exosomes can be used for hair restoration. They're very efficient. They also reduce the number of white hairs and they will increase the density of hair. Now, of course, treatment results vary from one client to another. It's very important to know that. But it's very, very promising for the moment. I personally find that these exosomes are more efficient than PRP. So currently for hair restoration in our clinic, we're proposing exosomes rather than PRP.
You talked about Morpheus 8. What are your thoughts?
So Morpheus 8, we have devices in aesthetics that we use. So all devices use the same principle, is that when you heat the skin to around 42, 43 degrees, you're going to get collagen stimulation, collagen production. And so we all know that collagen production is very important because we lose around 1 to 2% of collagen from the age of 30 onwards, and around 30% during the menopause period, which on average is between 47 and 53 years old. And so we have different devices. To summarize, we have lasers, different lasers. We have ultrasound, and we have radio frequency. These are the three main energy sources. There's also plasma to mention the fourth. So all these energy sources, as I said, have the same purpose: heat the skin to stimulate collagen. There are, of course, some differences. I'm just summarizing. So Morpheus 8 is one of the brands that has basically a device of radio frequency, which is a type of electric current that will heat the skin. And the handpiece has micro needles that go for the face between 1 and 4 millimeters, and for the body up to 7 millimeters. And it allows to deliver the radio frequency at specific depths. So the treatment protocol is adapted for every patient. Now, why to deliver it deeper? Because radio frequency, when delivered superficially, as older devices did, is only a treatment that can be delivered superficially. It means you have to deliver more energy. And so sometimes it's not tolerated by the patients. So preferably, by using these needles, you also get the mechanical damage, because we know that when there's any mechanical damage in the body, it's going to react by a healing process, also producing collagen. So you get both effects, the mechanical damage, and you also get the delivery of the radio frequency to the right depth.
All right.
The results are good. It's very good for tightening the skin, for lifting, improving the jawline and the face. It can also be used in the body to improve skin laxity, for typically in the abdomen, for example, or around the knees. One thing our patients should remember is that devices can only tighten the skin. They do not produce volume. So if you have volume loss, for example, if you have volume loss in the under eye with an under eye hollow, or if you have temple hollowness, devices will not be efficient. You need to use some type of filler, such as hyaluronic acid.
Okay, perfect. Thank you for this explanation. Now, I'm also going to jump, while we're in the subject of learning more about some treatments, the difference between Radiesse or Sculptra.
Yes. So we mentioned before that collagen biostimulation is very important. And so there are two main products. There are two other ones on the market. Let me be complete, maybe.
Yeah.
So the four products that are present on the market are called Radiesse. There's Sculptra. There's also Harmonica, which is a mix of hyaluronic acid and Radiesse, which is calcium hydroxylapatite. So it's called a hybrid filler. And also there's a product called Elance, which I do not use in my clinic. And it's a product that most experts think that it produces too much inflammation and maybe complications such as nodules, even when it's correctly injected. I will not talk about it, but I will talk mainly about Sculptra and Radiesse. So these products stimulate collagen. They're injected under the skin. They are diluted, typically in the Radiesse is diluted in saline and Sculptra in some distilled water. Now, Radiesse is going to improve the skin quality without giving significant volume. And that's something that's very demanded by our clients. As you know, there have been these last years where only hyaluronic acid has been used, and sometimes in large volumes where people have this overfilled look that we don't like at all as a specialist. And patients today are realizing that many of them have had too much hyaluronic acid. So today, more and more, as I mentioned earlier in my talk, we use more combination treatments. And one of the really pillars today is these collagen biostimulators. So Radiesse stimulates collagen, can be used in the face and body, gives excellent results that appear after a couple of months. That's the case for all biostimulators. And the results will last for a year and a half, depending on the age and the degree of the laxity. Sculptra, on the other hand, will give a little bit of more volume. And when you use it in the face, you will use 2-3 sessions, and you will be able to do some lifting, some tightening, but also some volume correction. It's an excellent alternative for clients who don't want to use at all any hyaluronic acid. It's a very good alternative also for patients who are very slim, very skinny, such as people who do intensive sports. As they have very little fat in their face, it's very difficult to inject them with hyaluronic acid without it being visible. And so Sculptra comes in handy because it's basically a product that doesn't really fill. It stimulates your own collagen production. So it does not work by filling, but by stimulating your cells to produce collagen. However, there are some always shortcomings. That's why combination therapies remain the ideal. You cannot inject Sculptra, for example, under the eye. You cannot inject Sculptra very close to the mouth because you may alter the freedom of movement, etc. Because as you produce more collagen, there could be a little bit more rigidity in the tissues. And so another use of Sculptra is butt augmentation or treatment of butt volume loss. Now, people should not confuse that with butt augmentation with surgery, which uses implants, or butt augmentation with fat, because those will give quite impressive results and sometimes maybe really too excessive. Sculptra, on the other hand, gives very natural results because you adapt it, first of all, to the patient's taste, which means you can use 2, 3, or 4 sessions. Also, the number of vials that are used per butt are different depending on the request. And so you can get a very natural result, get a little bit more projection of the butt, and correct sometimes. Some patients have a volume loss. They may also have a scar following liposuction or something like that, or volume loss following liposuction, which might have been excessive in one area. And so this use is very interesting. And finally, Sculptra can also be used to treat the appearance of cellulite. So when you have cellulite or cellulites, depending how you pronounce it, in the buttocks or in the thighs, improving the collagen content will make the cellulite less visible.
All right. Yeah, very interesting about both. This whole conversation now leads me to what is super important. So we spoke about wrong product, good products, wrong use, good use, wrong doctors, and so on. That's also the reason why we launched Aesthetic Links, especially in Dubai with over 3,000 clinics. That's so important to find the right one with trusted reviews, because now we can fake reviews on Google with real word of mouth. I want to hear a little bit more about your point of view on wrong injections or wrong doctors. Tell me a little bit more about that. I'm sure you have plenty of experiences as well.
I think I agree with you, Ivan. It's a very, very important topic. I would like to give some advice to our viewers and listeners. I think, first of all, people should remember that aesthetic medicine, there are 2 words, aesthetic and medicine. And medicine, the word medicine is very important. You really need to be a doctor to inject. There are exceptions in the US, in the UK, Canada, and in the Nordic countries, you have registered nurses, but they get the same training as doctors. So in these countries, they're authorized by the health authorities, and they are very well trained, and I've spoken to many of them, and they're extremely well trained and knowledgeable. But if we talk about most of the other countries in the world, doctors are allowed to inject. And I wouldn't just stop at the fact that it's a doctor. It's really a specialty. You need to know your anatomy extremely well, the techniques, the products, and also very important, and this is a point I'd like to talk about for a few minutes, is managing complications. You know, a doctor has to be able to treat you, whether he's an aesthetic doctor or family doctor or whatever, but he should know how to handle things when they go wrong. And that's very important. That allows your patient to feel secure, to be treated whether things go positively. Thank God, most of the time, we do not have complications. So, to give you an example, when you inject hyaluronic acid, you need to have in your office something called hyaluronidase, which is an enzyme that can dissolve hyaluronic acid. So there are some rare cases with it where hyaluronic acid may be injected accidentally in an artery or in a vein, and that may cause complications that can be quite severe and can go from skin necrosis. And in very severe cases, especially injections of the nose or injections of this area that we call the glabella and the nasolabial fold, may lead to loss of vision. And so it's very, very serious. Thank God these accidents are rare, very rare, but you need to go to a doctor who's very well trained. Now, many people say, how do I choose my doctor? There are some parameters. I can give a few comments about that. So first thing, your doctor has to be experienced. You have to ask your doctor since when he's been injecting. Your doctor ideally should be a doctor involved in teaching, go to conferences.
Which you are, by the way.
Which I am. So I'm a key opinion leader for brands like Allergan, Merz, and Galderma. I teach regularly doctors in Switzerland and abroad, and even in Dubai. And also I'm a speaker at international conferences. And that's very important because it means you're up to date. It means you have a lot of experience, you have the expertise, and you're knowledgeable. And also managing complications is very, very important. So one of the examples that I can give you is I once was called by a colleague who was injecting a patient, and she thought she had a complication. She thought she had injected an artery somewhere in the chin, and she called me, and she was injecting at a coiffeur, at a hairdresser's, not in her office because she was not in her country, and she did not have hyaluronidase with her. And so I went to my office, got hyaluronidase, went to her, then realized that she was not very familiar with the use of hyaluronidase. She asked me to stay, so I stayed, and we treated the patient, and thank God she fully recovered. So my message is that sometimes doctors may present very well, may talk very well, but unfortunately I realize that many doctors inject without having this hyaluronidase, which is really very important, I think. Also, doctors have to be able to manage an allergic reaction. It's very rare. I've never had an allergic reaction in aesthetics, although I've had it in internal medicine in the past. We all can be allergic to food, medicine, etc. But in aesthetics, it's very rare. People often talk to me about allergy to Botox, hyaluronic acid, almost zero, I would say.
Okay.
But still, a patient could faint, could have a problem, could have an allergy to like a numbing product, for example. Lidocaine, which is commonly used, may cause allergic reactions, quite severe sometimes. And so a doctor is really a doctor. He needs to know how to resuscitate, how to treat an allergy, a drop in blood pressure, manage a fainting patient, etc., manage a bleeding, all that. So it's very, very important. And so the doctor should be experienced. Some doctors go into aesthetics and they inject maybe a few patients a week. They're not very experienced, and one should. That's why I mentioned earlier on in my talk about the prices. So if the price is low, if you're in a non-medical setting, it's very important. I would never go to a doctor myself who's not in his clinic. I would not be injected by a doctor who's in a hotel, who's in a gym, because you see doctors in gyms, at hairdressers, in beauty salons. That is not a place for a doctor. A doctor who is a serious doctor, who has a good career, he'll be in his center, he will have assistants. It's a medical setting, and that's something that you should look for. It's like any field. It's like a restaurant. I mean, when you go to a restaurant and you have flies and mice on the floor and things like that, you don't want to eat there.
Yeah, definitely.
Yeah.
Super interesting. So, from what you're saying, can a good doctor who's trained still have some issues can still occur, right? It's not that the doctor is necessarily bad. It can still occur in any scenario, right?
Yes. So I always tell my patients that a doctor-patient interaction in terms of treatment is like any interaction between two individuals. So a problem may occur not because the doctor did something wrong. Sometimes your body may react. Now, let's take a common example. Common meaning more common than others. Some patients who get hyaluronic acid injections may develop a little lump, what we call nodules. Now, these do occur. They may occur because the doctor injected the product too quickly or in large amounts or too superficially, like typically if it's a thick product, or because it was not properly molded and put in place. So it could be a technical error. It could be an inappropriate choice of product, like using a thick product superficially. And it may be a reaction of the patient. The patient may react. I'll take an example. If you have an infection or a vaccination or a flu or a sore throat, it may happen that your injected hyaluronic acid may swell, may cause some lumps or nodules, and people are scared of lumps or nodules because that in our subconscious is we think it could be a cancer or lymph node or something like that. That most of the time, all these things resolve spontaneously. They may be helped with medications such as antihistamines, cortisone for a few days, and they resolve fully. So people should not be scared of that, but they should consult. And they should consult an aesthetic doctor who's more familiar with treating complications related to injections than just any doctor. And sometimes these doctors will give you wrong information because they're just not trained. Regular doctors do not get training on complications of injectables such as Botox, hyaluronic acid, or collagen biostimulation. And often there's a lot of information on the internet that's not up to date, or that's written by someone who wants to give a bad reputation to a product. So I would always consult a doctor who, any good doctor is supposed to give objective information to patients, very transparent, and explain things. So I would say that these complications are not common, but they may occur. And again, any good doctor should know how to handle them.
Right. Now, are there any products which are on the market and people talk about which you would not recommend using?
Yes, so I would definitely not recommend using products that are not resorbable. That means product that will not be eliminated naturally by the body.
Right.
So hyaluronic acid is eliminated. Collagen biostimulators are eliminated, contrary to what sometimes is written on the internet, because people confuse two things. Collagen biostimulators cannot be dissolved, but they're injected superficially. So the risk when injected superficially is very, very low, almost zero. But again, it should be in good hands. Hyaluronic acid may be dissolved, but both hyaluronic acid and collagen biostimulators will be eliminated by the body at different rates, depending on each patient. Products I wouldn't use are these non-resorbable. What are these products? These are products that were used in the 80s and 90s. Some of them have particles, some of them have silicone, some of them are products that just remain in the body. They're what we call permanent fillers. Whereas today what we use are non-permanent fillers, resorbable fillers. This definitely, there are some doctors who still use them because it gives a long-term effect, but the long-term side effects as well. You may get really lumps that need to be removed surgically. They may deform the face. They may cause also problems when you inject the good products elsewhere in the body because your body will react to them. That definitely I will not. I will not use Botox that does not come from one of the main companies. So that's why anything super cheap means the product is not good. I have a friend who's a consultant at a aesthetic company. He's a specialist in biological products such as hyaluronic acid. And he regularly, companies submit to him products they wish to market. And he tells me, the products that we see under the microscope and we study is just, there are some horrible things. To give you a simple example so that our viewers can understand. Typically, when you look at hyaluronic acid under the microscope, naturally occurring substances typically have round shapes. So our body does not react to things that are round or elliptical or things like that. But our body will react to things that are pointy, like triangles or things like that. And these hyaluronic acids, the way they're made, their content and their shape, has an influence on the way we recognize them as being what we call self or non-self. Because our body, our immune system, is very well adapted. Like it does not usually reject food. It may be allergic to food, but usually does not reject food. It does not reject things that for the body seem natural products, but they will reject things that look strange, and the body can recognize that. So I would say avoid any cheap product, anything also that is related to trends. I would avoid that. And that's something maybe that's interesting to talk about.
It is.
One should distinguish between medical developments, related to serious research, and things that are just marketing. So, people try to sell more treatments by just marketing them, giving them some names like foxy eyes or, certain like laser peels that give them fancy names. One should always look it up and see, is this something really published, described, etc., or is it just a name that's been coined? It's just their desire, basically. It's their desire makes the desire of clients increase, and they want them to come and seek more treatments. That's something important.
It's super interesting, especially on Instagram, on social media. there are so many trends.
Yes.
And it's only like one influencer, the wrong one with the wrong product, and people trust the person.
Exactly. Like I was reading just a couple of days ago on Instagram saying that there was something that was a breakthrough in science, which is injecting wrinkles in the upper face with small amounts of hyaluronic acid. This is not a novelty. This is something that has existed for many years now. But the problem is, if I inject these wrinkles with hyaluronic acid, but the muscle is moving, you will still have wrinkles. So it's not really a replacement for Botox. It may help. It will reduce the wrinkles. We still use it in some patients who have deep wrinkles because they've started their Botox treatment late. But it's nothing. It's not a breakthrough. It's something I've been doing for 10 years. So this is an example. When I read that, I said, oh my God, people will just invent anything to get more clients,
That's insane. All right. So I think we'll wrap it up. Thank you so much, Dr.
It's a fascinating topic. There's so many things to talk about.
It is. And that's what I love is even for me, which is not an expert in that specific field, I learned so much here. And that's also why I'm super happy that our app puts forward trusted doctors, clinics. Your clinic is available on our app. If you can just pass me, we have a small token of appreciation under the sun of Dubai.
Thank you.
You can have
Thank you very much. Thank you for having me.
With great pleasure. Thank you very much for watching our first episode with Dr. Madi. Please subscribe to Dr. Madi, subscribe to our channel, like our video, and download the Aesthetic Links app. Thank you.
Thank you for inviting me.
With pleasure.